community station. This is Bobo FM.
The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Do you have a healthcare question but not sure who to ask? Contact HSA's Patient Call Center to speak to one of our experienced clinical team members. We are here to answer your questions and help guide you through your healthcare journey. Need to make an appointment? Our team can help. Contact HSA at 949-8600 or email info@hsa.ky. At HSA, we are committed to caring for you.
All right, welcome to the show. It's Bobo, 103.1 FM. It's Dane here with you in the studios. Each weekday, we take some time and we do these very special interviews where we have superheroes coming from HSA just to discuss their specialty. We may even have a certain individual that come on to talk about maybe a seminar or a conference they're going to be having or a specialty that they're now offering at HSA because they're continuing to grow and definitely going above the technology, I like to call it. We have a very special doctor here in the studios joining us this morning, Dr. Ernest. He's general surgeon and head of surgery for HSA. Very important job. Good morning, Dr. Ernest. How are you?
Good morning. Yeah, I'm great.
Yeah.
I love it when, the hurricanes have gone and we get a nice cool breeze. Cayman becomes perfect.
It does, doesn't it? It really, really does. And I think we were past that season. I want to be careful and knock on wood on this one, but it looks like
it's gone.
Yeah, it looks like it's done. The cold weather is making its way in now. My son is in Cleveland. He's doing high school over there, and it's his first time seeing snow. And they're about to go through like an Arctic blast very soon. So he's about to see cold weather like he has never seen it before. But Dr. Ernest, thank you so much for joining us today to talk about your specialty. And we are honored to have you here in the studios. Can you give us a little bit, for those listeners that have never got the opportunity to hear you on the radio waves before, just give us a little bit of your background and how you got started and how long you've been with HSA.
Right. I've been a surgeon now for 35 years or so. And I came from the UK and I landed up here in the Cayman Islands.
Not a bad place to end up.
Lovely. As usual, people come for 2 years and then after 2 years said, oh yeah, that was 30 years ago.
Yeah. You regret it?
Not a day.
Yeah.
Not a day. I mean, Cayman has been very good to me and I've been at the HSA now for 7 years.
Yeah.
And it's a wonderful organization where we treat everybody.
Yeah.
Everyone.
I know that. You know what? Where I can echo that is because everybody that passed in the studios have said the same thing that you've said. It's a great organization to work with. People have worked 20 plus years, 30 years even. So it's a company that's working for because people tend to stay. They're there for the long haul, right? So
Absolutely.
Yeah. So congratulations to you. And thank you so much for joining us on the radio station today. Now, we're going to talk about one of your specials, just one. What exactly? I always wanted to know this because this word was just brought up to me recently by my wife, of all people. And my son also felt like he had this at one point. But what exactly is this topic that we're about to talk about, hernia? And why do it tend to occur frequently more in men than in women?
Right. Well, let's explain what a hernia is. Your body is covered by muscles. So what muscles do, it also keeps all your insides firmly inside.
Yeah.
So they don't pop out.
Yeah, exactly.
So this body covering, the muscles covering your chest and covering your abdomen is continuous. But there are certain areas of weakness. So let's go to the first area of weakness, which is your belly button. When you were in your mother's womb, the umbilical cord was fixed there.
Yeah.
So blood vessels and everything go there to feed you when you were a baby in your mother's womb. Now that left a little bit of a gap in the muscles. So as you grow up, usually this gap closes up. but sometimes it doesn't. And when it doesn't, your belly button may pop out, what we call an outie, whereas other people may have an innie, which is inside.
Yeah.
So some of these outies will actually be on top of a slight gap in the muscles, and that's what we call an umbilical hernia. And that's very common in children, especially in the Caribbean. I've seen more umbilical hernias than I've seen in my last 30 odd years of practice outside the Caribbean.
Yeah.
It seems to be one of the things that occur very commonly here. Now, most children will have this closed off in a year's time, maybe, when they are 1 or 2, the belly button really closes off them, but some don't. And it's those that will need treatment, the ones that don't have the belly button hernia, the umbilical hernia closed, then you may need a small operation to get that sorted.
Yeah. You spoke about earlier, which leads me into my next question, the most common hernia.
Yeah.
Is there any other ones that you're finding that's very common here?
Yes.
Especially amongst males?
Well, that we are talking in terms of the groin hernias, the inguinal hernias as they're known in medical terms. Now, that is more common in men because what men have and what women don't have. When, again, we go back to development inside the womb, when a man develops, a boy develops inside the mother's womb, the testicles actually form inside the abdominal cavity, that's inside the tummy. And somewhere around the 8th month of pregnancy, they start traveling down to go down into the scrotum. And so when they travel down, they take along a little bit of the coverings of the abdomen. And think of it like a plastic bag where you push something, you push a plastic bag, you form a bulge. And that bulge is what is a hernia. So it leaves a little gap in the muscles, and that gap can be filled with a bit of fat that's inside, or sometimes even more dangerous, a bit of intestine. Now, obviously, men have testicles, and men have this gap, so therefore inguinal hernias are more common in men.
Yeah. That's a big one to watch out for. And while you're on that, Dr. Ernest, let's talk about something that we ignore all the time, especially around Movember. And we're trying to watch out for all warning signs. There's different things when it comes to men's health. Let's talk about the early warning signs and what men should look out for when hernia becomes serious. I once heard a guy said, I think I have hernia, but I'm going to leave it alone because I don't want surgery. That's what he said. His exact words, I don't want surgery. I'm that terrified of surgery. I don't want it. So let's talk about the warning signs and just how serious this can get.
I think the best warning sign is pain. Now, the hernia becomes bigger and more painful when you do physical work, when you exert. What happens is when you lift anything or when you do any major physical work, you have to tense your body. And when you tense your body, the pressure inside your tummy rises and pushes things out through a defect or a gap. In other words, through a hernia.
Yeah.
So if you have a little bit of the fat coming out, we have fat inside also, a little bit can come out. That doesn't cause so much of a problem. But if a bit of the intestine comes out, it gets caught in the hernia, and then the hernia squeezes the intestine, squeezes out all the blood. And that when you have a part of the body that does not have blood, it can turn bad. Can turn into gangrene and becomes a very serious problem. Now that doesn't happen all the time to hernias, but it can. And that's the danger that we worry about, that when a bit of the bowel gets stuck within the hernia. So when should anybody see a doctor about a hernia? As soon as you feel it. When you feel there's a lump where there shouldn't be a lump, and also a lump which goes in and comes out. That's the classical thing of a hernia. You get a little lump, soft lump, it doesn't cause any symptoms, comes out, gives you a little funny feeling, especially you go to the gym and think, okay, I'm going to do 120 pounds today. And you do the 120 pounds, and then you suddenly, there's something funny going on down there.
Yeah.
And then you feel, there's a little, slightly painful lump, but then once you lie down, it goes back in. And that's how you self-diagnose a hernia. But The important thing is, once you have a hernia, you need to see a doctor. Now, not all hernias need to be operated on, but anything that can cause a difficult situation where the intestine is caught, those are the ones that we need to operate on.
Yeah, makes sense.
And talk about the operation. It's not a biggie.
Yeah, that was the next thing I was about to jump into, because why do you think, like, a lot of men are like, I'm not going to do this?
Because they're chickens.
Yeah.
Chickens.
Well said, doctor. Well said. Hey, straight to the point. Straight to the point. They're scared of a little bit of needle, afraid to go to sleep.
Yeah.
But what is it, though? How easy is this procedure?
Okay. Well, the inguinal hernia is the most common hernia in men, and it is done. It takes around about 40 minutes to be done. We can do it under local anesthetic. We can do it under general anesthetic. And almost all patients come in for the procedure and go home the same day, within a couple of hours. The only thing you got to do to take care of the hernia is not to lift any heavy weights for about 4 weeks after the surgery.
Yeah.
Because we want everything to heal before you start stressing it.
Is it painful?
Well,
you can't start a conversation with painful doctor.
Well, no. It's very variable. That is what we find. There are people who've got up and walked out of the operation table. The ones who have it under local, they just get up and walk.
Yeah.
There is actually a hospital in Canada called the Shouldice Clinic where they only do hernias. And they make the patient walk up and down the stairs.
Wow.
So that if you want your food after surgery, you got to walk down the stairs. So it makes people walk. And it's a fallacy that you need to rest after surgery. Most of the time, we want people to be moving around and moving and doing things. Just, not, shifting furniture or pushing a car or something like that.
Move around, yeah.
What you do every day. And hernia operations, they're very straightforward and simple. Complications are rare. You can have a little bit of a wound infection, which is very easily treated. There is a recurrence rate, no matter how good the surgeon or whatever method you use, there is a certain proportion of patients where the hernia will come back after surgery.
Yeah.
And we estimate it to be somewhere around 0.5%, which means 1 out of 200. And that's the acceptable one.
Yeah. And do you think you just said something really compelling a couple minutes ago, because I kind of felt that there are some people out there. I'll use it in your terminology. There is a little bit chicken about going to the doctor. I'm scared of every little thing when it comes to the doctor. But there's also those that perhaps don't trust doctors anymore. Have you seen that?
There's always mistrust of everything. And the best thing to do to overcome this sort of mistrust is to be open and talk about every single thing of the procedure. No hiding anything. Just be absolutely straightforward and blunt about it.
Yeah.
I can't sugarcoat and say, look, this is not going to cause you any pain. Any operation will cause you pain.
Yeah.
But we mitigate that we give you painkillers to tide you over the period. And I can never say this will be 100%.
Yeah.
There will be always one out of so many patients will have a complication. And as long as you're upfront about it and be honest about it and say, these are the difficulties that I have, these are the problems that you can face, these are the percentage of patients who have these problems, and if they're just a few, like 1 out of 200, versus what happens if the hernia gets blocked.
Yeah.
Now, if it gets blocked, your intestines get blocked, which means you can't eat anything, you start vomiting, and after that, the intestine actually undergoes ischemic necrosis, which means no blood supply, it turns black, becomes gangrene, and then it can cause death.
Yeah.
So that's a very real problem when you have a big symptomatic and painful hernia. So once your hernia causes pain, don't wait anymore.
Yeah, you got to go to the doctor right away. And would you say that to the people that ignores it too? They know they possibly have a hernia, but it's not painful, but they don't want to do anything about it?
It will become painful.
Eventually, right?
Eventually.
Yeah.
And there's the other thing is, you don't want to bulge, in your body that's unsightly. I'm now talking about the umbilical ones, around your belly button. You don't want your belly button. You'll never be in a swimsuit.
Yeah, exactly. For women out there listening, that will get you up a little bit. We have Dr. Ernest here joining us from HSA. We're talking hernia, and we're talking mostly around males. And the reason we're doing that is not because we're saying we're picking a particular gender here, but we're celebrating November, right? And we know, ladies, you can admit this, men do find it hard to go and get a checkup or go to the doctor for little things. So these are just one of the conversations that we're having this month with HSA. And we're pleased to have Dr. Ernest here joining us, wealth of knowledge and head of surgery here at HSA. So a very big role. At times you may hear him having to take a break or hear the phone ringing in the background because he's so busy, but we're happy to have him on, and we're going to only have him for an hour. So we'll take a quick commercial break right now. And when we return, we'll talk more, but we'll discuss the topic around the surgery, more around the surgery with hernia. And you're not going to want to miss this. If you have any questions, go ahead and send it to our Instagram or our Facebook page at Bobo 103.1. Hit that message icon, and we would love to hear from you.
The Health Services Authority has over 120 world-class physicians offering the most comprehensive range of specialist services on island. Our dedicated team of professionals provide the highest quality care in orthopedics, interventional radiology, women's health, geriatrics, and a host of other specialist areas. We are a JCI accredited organization with a proven record of excellence. At HSA, we are committed to caring for you. For more information, visit hsa.ky.
And we are back. Welcome to Bobo 103.1. It's Dane hanging out with you here. Thank you so much for being a part of the show today. This show is dedicated to all things HSA. It is their show for the next hour, just before the BBC. And if you have any questions for the doctor that's on call with us right now on the radio, you can just go ahead and send a message to Bobo 103.1 FM. Hit that message icon, and we'll make sure it gets to the marketing team, Monique, or over to Dr. Ernest himself. Now, we were talking about hernia. We're still going to continue with that conversation. Christmas is coming up close. Doctor, what are your plans for the Christmas season, except for working?
Well, family's coming over, so we're going to have a good family Christmas.
Is that from the UK?
Yes, daughter's from the UK.
All right, perfect, man. All right, so we were talking earlier about hernia and just the different conversations around it, what it is, surgery, how painless it can be. For some, painful, but that's a part of the nature when it comes to surgery, depending on what level of experience that you're going through when it comes to your hernia. Now, some of the questions I want to ask is, how has hernia surgery advanced in recent years, and what options are now available for the patients to make it a little bit easier?
Right. Hernias used to be repaired doing open surgery and putting stitches in and hoping the stitches will cure the problem. The problem with that is that method sometimes gives quite a high recurrence rate, up to 10%. So various advances were made, and the most important advance is using a mesh to bridge the gap. So a special type of, I should say plastic, but PTFE, or a special man-made material is woven into a mesh, and we stitch this mesh onto the muscles, and the muscles then grow into the mesh and give it its strength. But the main thing is we think of the mesh like scaffolding, where the body itself builds the structure around the scaffold and makes the hernia repair sound. So that is probably the best advance in the last 30 or 40 years in hernia repair. We can do it the open method, we can do it the laparoscopic, which is keyhole method, and it all depends on whether the patient wants a different type of cosmetic effect, or there are many factors that decide which procedure would be better. The benefits of either one of them is pretty marginal, one on top of the other. So whichever that doesn't give a recurrence is probably the best method.
Yeah. And we see that was basically describing the open repair versus the keyhole.
That's
type
right.
hernia surgery, right? But you will discuss that with the patient on which one is best for them.
Correct. And each patient is different. So there are certain approaches for certain types of hernias, and some which are better served by doing open, which are better served by doing laparoscopic. That's the keyhole method. But ultimately, there's also patient choice.
Yeah.
And we do find that once you present all the facts to a patient and say, look, it's this or that, it's your choice. And well, the difference between laparoscopic and open hernia in this case is pretty marginal. They say that there is, the patient returns to work 1 day earlier when you do laparoscopic compared to open surgery. Now, the difference is that we're not cutting into the belly. We're just cutting on the outside, on the muscles. So the normal thing that we keep patients off work and that sort of thing is only dependent on pain afterwards.
Yeah.
And both are equally painful or painless, depending on the type of patient. So it's a very, very personal choice as to which type of surgery you want to do. This is for the inguinal hernias. For the umbilical hernia, if it's a very big one, we can do it laparoscopically by going into the tummy. If it's a smaller one, it might be easier just to do a smaller repair in the belly button so that we can hide the scar. So at the end of the procedure, you don't see a scar at all.
Yeah, that's good. All right, so let's talk about one of the things that we did discuss, and I do believe, Doctor, you did spoke about this, and you talked about the recovery stages here, but just for those that are tuning in for the first time, what does the recovery process look like after a man has a surgery for hernia, and how soon can they return to normal activity at work?
I would say almost all patients can go home the same day. So you're home and you're treated with tablets for pain. The first day or two, yes, you will have pain. Okay? And be prepared for it. What we normally do is inject a local anesthetic which lasts for 6 hours after the surgery.
Oh, wow.
After the 6 hours, we ask you to take your painkillers before the pain starts, and it will dull the pain. By the second day, you have 50% of the pain that you had on your first day. And the third day is 25%. That's a rule of thumb that I use, and I find that most patients will feel that. Within 3 or 4 days, you should be doing absolutely everything normally.
Yeah.
Your day-to-day stuff. So basically, if you are, say, like a desk job, or a job like yours, Dane, okay, you can go back to work within 3 or 4 days.
Yeah.
As long as you don't have pain.
Yeah.
So we leave it to the patient to decide when they want to go back to work, especially. But say if you're in a construction job, I would say a minimum of 14 days before you go back. Where, you're doing heavy physical work, I wouldn't advise that because you may disrupt the wound and do think if you're doing heavy physical work. So a minimum of 2 weeks for heavy physical workers. But for straightforward, 3 days, 4 days should be enough, but we tailor it according to what the patient needs.
Yeah.
And some people find that it's more difficult, 2 weeks. But the average, somewhere around 2 weeks sounds to be an average. The occasional patient may want more.
Yeah, absolutely. This sounds good. This is a wealth of information, and I hope that it's speaking to a young man out there or a guy in general that's been avoiding that pain or avoiding that process for a very long time. What I want to ask, which is a very important one, is I don't know if I fit in this category, but is there a lifestyle or occupational habit that increases a man's risk of developing hernia?
Physical work.
Yeah.
Does.
I lift the mic constantly here.
Yeah, I mean,
or push buttons. I don't think mine is physical at all.
Yeah, if you have to lift your whole console every day, yes, you will develop
I should be concerned, right?
But the guys like the movers, construction workers, they're more prone to because they do lift heavy weights. So those are the people who are prone more. Well, the athletes like footballers, they may develop a little twinge. And that will actually prevent him from, say, scoring a goal. You will need a hernia repair then.
Yeah.
Even though it is just a minor twinge. So it depends on your occupation as well.
Yeah. Okay.
And that's what we classically call a sportsman hernia, where they just feel a twinge, they're just a little, maybe a little defect, maybe nothing much, but since they are very skilled and highly paid.
Yeah,
and they need to score those goals. They may need an operation. So there are degrees where we actually, in a person who is more sedentary, I would probably not advise that person to have a hernia surgery.
Yeah. Well said. Now, what about the guy that's embarrassed or hesitant to come in? Like, you can talk to them one-on-one right now. Let them know why they should come in, because there are a few.
Yeah, but then you see what happens. You just kick the can down the road. Basically, you're putting your head in the sand and say, oh, I don't want it now, until it becomes so bad that you have to do it as an emergency. And that is a totally different ballgame. So if a patient comes in with a hernia as an emergency with a blockage, you need to stay in a hospital probably 5 to 7 days after surgery. It could be a big surgery. There could be a lot more complications. And in a patient who is not that fit, could even take their life.
Yeah. Be careful, fellas. This is one of those things that you want to pay close attention to. The doctor is speaking some really big facts here, and it's giving you the hard reality. Like, stop being a chicken about it. What's so difficult about stepping in and caring about your health, putting your health first? If you got a family, especially, that's even more important these days, to coming in and making sure that you are running up to par when it comes to of course, you and your family. Anything to recap this conversation, though? Anything else that you want to just reinstate, doctor, or just bring back up again, because it's a very important thing to remember before we get into our next conversation after our break? You can go ahead. Yeah. Well,
I do find a lot of younger men come forward nowadays. The older, I'm saying older, I suppose the patients who are older than me are older.
Yeah.
They are the ones that tend to say, I don't want to bother the doctor, that sort of thing. That attitude is slowly going.
Yeah.
And we find that men are coming much more often to seek medical attention for something.
Which is good. I like to hear that.
Oh, yes.
Love to hear that. So keep that going. For Movember, that's a very important message, guys, for you to realize that let's break this stereotype that is going around that men, especially Caribbean men, don't like to go and get their checkup done, and they always wait to the very last minute, or when something becomes an emergency, or it becomes that painful that you can't barely walk, and you have to get an ambulance to come to the doctor, and that's when you have to find out that something serious has been going on. Let's break that stereotype, right? So listen, we're going to be right back. We're going to take a quick commercial break. When we come back, we'll jump into a different conversation. But if you have any more questions around hernia, please do not be afraid to message us. Go ahead and use our Instagram. That's what it's there for. You can send us a message at Bobo 103.1 FM. Once again, that's Bobo 103.1 FM. And that's both on Instagram and Facebook, all right? So we would love to hear from you. And it's open right now. We'll get that message to the marketing team of HSA, or we'll send it directly over to the doctor himself. We're joined by Dr. Ernest, head of course, surgery at HSA.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
Welcome back to the show. It is Bobo 103.1 FM. I am your host, Dane, and it's my pleasure to be hosting with you today. Don't forget the show runs for 2 days, Friday and Saturday. Just in case you missed it on Friday, we recap it again on Saturday. But thank you so much for joining us. It's all brought to you by HSA. We're joined by Dr. Ernest here in the studios with us today. He is, of course, head of he's a general surgeon and head of surgery of HSA. The new conversation that we're going to get into is one that I need a little bit more understanding on. It's new to me, if I got to be honest with you. I've always heard the word, but I need to get more familiar with it. Colon cancer. And let's talk about it. Why is it such a concern for men, particularly here in the Cayman Islands? Did I say that right, by the way, doctor?
Yeah, colon cancer, colonic cancer, cancer of the bowel.
Yeah, perfect.
Yeah, that is my subspecialty, to deal with the bowel. I mean, everybody asks me what type of surgeon you are. I just tell them I'm a plumber.
Yeah. I love it. I love it. Okay, so
right. So colon cancer is the second commonest cancer in both men and women. I mean, women have breast cancer, and men, it's prostate cancer, which is the most common. But colon cancer is the second commonest in both men and women. And it seems to be getting a little bit more prevalent. We often used to say that colon cancer was a disease of the older age group, 60, 65, 70. But now we're beginning to see a lot more younger patients.
Yeah.
And in the Caribbean, yes, this is one of the areas where there is a high incidence of colon cancer. Now, just to go probably to talk about the causes of colon cancer, maybe the simplest way to say it is processed food and processed meat, to be more precise. So your sausages, ham, bacon, that sort of stuff, or cured meats. We find that colon cancer is very high in these areas in the world. In Western Europe, Russia, United States, Canada, and the whole of North America. Not so common in South America, in Southern Europe, in the Middle East. It's also very common in the Far East, in Japan and Korea. And then if you travel to Africa, it's very low. And it's very low in subcontinent India. Asia, somewhere in between. So, people are wondering, what is the connection?
Yeah.
And there's actually a very simple connection. People in the areas that we describe with low incidence, like Africa and India, people eat a lot more plant-based food and very little processed meat. It has to be processed meat, which is causing the problem. The other lifestyle causes, and because we these areas eat a lot more of plant-based food, you have a lot more roughage, a lot more fiber. And fiber seems to be the thing that protects against colon cancer.
I was watching this documentary on Netflix. I don't know if you had a chance to see it, but I forgot the name of it. But it was basically, I think the title was "You Are What You Eat" or something like that.
Yes, you are what you eat.
Was that what it was?
Wasn't it about the 600-pound person diet or something like that?
Yeah, I think so. Yes. And then they did a research where on the other side of the bridge, there was two sides of a bridge, right? So basically on one side, there was a community that was driven off of processed food, really worked out. There was nothing really going on there when it comes to working out at all. They were working heavily, working more than 9 to 5. And then on the other side, there was the older folks that were mostly eating like farm to table, right? Taking care of themselves, walking every so often. And you find on that end, there was less sickness in that area. But on the other end of that bridge, people were constantly being sick or being told that they had cancer.
Yep. So
it really, what you said really resonated to me, because it's like the only thing that has changed drastically in these days, and why people are getting younger and younger people are getting sick. Technology is one. Technology is advanced. We carry radioactive technology in our ears, on our hands. It's constant. The processed food is stepping up. Like I've never seen processed food like we've seen it here in Cayman. Like we have every single franchise. We're missing probably two that is not here. But you could turn a corner as soon as you leave the radio station, and it's easier for you to purchase processed food
and cheaper
than it is for you to go and find food that's good for you. So some people are like, I'll just get this because it's right there, right? As you can just throw a coin and you'll find it.
I mean, I read a report that says that Cayman has the highest cost of living in the world.
Yep.
Not only anywhere in North America or the Caribbean, in the world. So food is expensive here. What, to buy a cauliflower? $10?
Yeah.
Woo.
Just thinking about it.
Yeah. Right. So the food that matters is processed food. And what happens with processed food is it gets absorbed very easily. And because it gets very absorbed easily, there's hardly any residue that goes into the colon. And that seems to be one of the factors. New research shows that it's probably one of the factors that causes obesity as well. Because what we eat has very little residue, and your gut says, hey, give me some more. Give me some more.
Yeah. Yeah.
So you eat more and more and more, even though, your body doesn't need it. Anyway, getting back to colon cancer, the other things, of course, good old cigarettes. Yep, it's
The big one.
implicated in every single cancer. Alcohol is a plus minus. Some people say in moderation it helps, and in not so moderation it doesn't.
Yeah.
But anything in not so moderation will not help.
Exactly. Well said. What I want to do, no, sorry, go ahead, doctor.
No. It's just that it's the lifestyle that causes it, and that's why we're seeing it in younger people.
Yeah. What is the major risk though for men?
The major risk is that the whole problem with colon cancer is it's silent. It doesn't give any symptoms until it's late. So it'll sit there for years and nobody will know about it until suddenly you find it's so spread everywhere that we can't do anything. So around about 30 years ago or 35 years ago, certain countries in the world decided, look, if we cannot pick it up early, we must try and screen the population and see if we can find early signs of it and therefore treat it before it becomes stage 4.
Yeah.
So, I mean, just to give you some figures, if we catch it in stage 1, it's 95% successfully treated. Whereas if it's in stage 4, less than 5% have a survival. So if we catch it in stage 1 or stage 0 sometimes, what do you mean by stage 0?
Yeah.
Because colon cancer starts off as polyps. They're like little mushrooms that sit in the colon. And they sit there, don't cause any problems, and minds its own business and doesn't create any problem. Suddenly, after about maybe 8 or 10 years, one of these polyps can decide to turn into a cancer. So that comes to when they originally thought of the screening is that we need to look for cancer and we need to look for polyps as well. So the original screening, we get a colonoscopy done, we look at the entire length of the colon, find a tumor if there is a tumor, or find a polyp and remove it. And so that is the standard colonoscopy-based screening that we do for colon cancer.
Okay, wow. Yeah, there's a lot that we're learning here today. And like I said, the show is going to be very informative. Early signs, even though you said this is hard to pick up on, what are some of the early signs that men should pay attention to that they can say to themselves, I think something's wrong?
Red in the pot.
Oof.
When you sit in the morning on your wonderful throne,
Yeah.
please look down the pot. If you find anything red, blood is the first sign. But it's also a sign of a very common disease, hemorrhoids.
Yeah.
So there is a differentiation that a doctor has to do between hemorrhoids and a cancer.
Okay. All right. Well said. Look out for red on your throne. It's one of the early signs. And definitely go to the doctor. Even if you feel like it's, because as Caribbean people, we feel like we're doctors automatically. What grandma said it was.
Yes.
That's what I'll call grandma and ask her. She's my family doctor. How often should men be screened, doctor? It happens. I still have my wife calls her mom. Hey, what remedy should I cook up instead of going to the doctor? So yeah, that's our family doctor, I think. So how often for me, example, me as a man, should I get screened for this?
Well, we usually start the screening at 45, and we continue 8 to 10 years, depending on the family history, every 8 to 10 years after that.
Okay, that's good. All right.
That is one way of screening. There is another way of screening is by doing a stool test. So you can do a stool test every year, and if any of them become positive, then you go on to do a colonoscopy.
Okay.
Now, this is very dependent on having a general practitioner that you go to as a regular basis. You have a doctor that you see on a regular basis and who will follow you up. So that is entirely dependent on that relationship because the doctor will pick it up and then send you on for a colonoscopy. Now there's one problem in Cayman. People don't go to a general practitioner.
Yeah.
I mean, they come to me to write diabetes and hypertension medicines. I don't know diabetes and hypertension.
Yeah.
I'm a surgeon.
Yeah.
So they need to have a family doctor, a doctor that looks after them for all the ailments, for the vaccinations and things. And that is important if you're doing the stool test. You need to have that.
Yeah.
relationship.
Very important. What screening for options are available at HSA right now?
So we have all the options available. Now, the gold standard, what is the best, is a colonoscopy, because you can pick up colon cancer and you can also pick up polyps.
Yeah.
Now, none of the other screening procedures will pick up polyps. And the idea is if you pick up a polyp, remove it, you prevent the cancer forming 10 years from now. And there are several patients whom we have treated, taken away the polyps, and we followed them up and found no further cancer.
Wow.
So that is probably what we call as the gold standard here. But the other ways is to do this stool test. It's called a FIT test or fecal occult blood. That picks up about 80% of it. So there is a certain proportion that it will miss.
Yeah.
The other way of doing it is to do a CT scan, but then a CT scan will only pick up a larger tumor. The smaller polyps will be missed on a CT. And we tend to use it only for patients who are quite frail.
Yeah.
And I would use it sparingly rather than to do a CT scan. You do get quite a lot of radiation, but if you're going to be missing the smaller things, and if you do find something, you still need to undergo a colonoscopy.
Yeah.
So I would cut out the middleman.
Yeah. I
And,
agree.
CT scans are not a very good one unless you say you're frail, you're old, and we really need to know if there's something going on in the bowel. I would do that
Yeah.
in that sort of circumstance. But a fit young person, a CT scan, no.
Yeah, to do more. Now, the sad news is there are people that are told, unfortunately, they do have this cancer. What are some of the treatments that are offered at HSA that can help them in this journey?
Right. The mainstay of colorectal cancer is surgery. We have 3 specialist colorectal surgeons in HSA, and we are trained to do colorectal surgery. And we do almost all our operations laparoscopically, keyhole. There are only certain circumstances where you can't do the keyhole, and therefore you do this. We also have transanal surgery, and we do the endoscopic surgery as well, the colonoscopic removal. And also we can do a procedure if it's way down in the close to the anus. We can actually remove the tumor going through the back passage. We have special instruments that we can remove it without removing the entire length of bowel. And I would probably say that we have the most comprehensive services for colorectal surgery because we have a good team. We have 3 of us, so the 3 of us who do colorectal surgery, and we cover all aspects of colorectal surgery. People talk about robotics and robotic surgery. Colorectal surgery is one field where we have not seen a clear-cut advantage of doing robotic surgery, because the same approach is done for laparoscopic surgery. The only difference is in robotic surgery is that you cut out an assistant.
Yeah.
Whereas in laparoscopic surgery, we need an assistant to hold the camera. In robotics, the camera is fixed to the machine and the operator moves the camera about. So that is the main difference in colorectal surgery between robotics and laparoscopic.
Makes sense. This is, and this actually leads me into my next question because when you talk about that camera, right? I think some of the common reasons that men delay screening is they've heard about other experiences, and this camera keeps coming up.
Oh, well, just think of it this way. We do these under sedation.
Yeah.
Okay, so you'll be asleep during the procedure, you don't feel anything, and more importantly, you won't remember it.
Yeah.
Which I think is the better effect. 5 minutes afterwards, you wake up, I briefly tell you what's happening,
Yeah.
and sort of brief you, but you won't remember much. So you'll be given a report that tells you the entire findings and what to do. And we tend to give a follow-up phone call a week later just to confirm that everything is understood
Yeah.
in the report.
So good. So good. Making me feel comfortable already, doctor. So let's talk about the lifestyle that this play in prevention. Let's talk about prevention, that this doesn't have to happen to you. There are certain things you can do right, to avoid things like this. We talked about processed food and just the food choices. Let's start there. But let's also talk about like different lifestyle activities that you can do to avoid situations like this and hear this word.
Well, the main lifestyle choice is that burning stick in your hand.
Yeah.
Stop smoking. That is an absolute contraindication. Meaning that's one thing that absolutely contributes to it. Alcohol, a glass of wine, a beer is fine.
Yeah. Keep the doctor
A
away.
bottle of wine, a bottle of spirits, a crate of beer is not fine.
Yeah.
Okay, in moderation, it's supposed to help.
What's moderation, though? Because I've heard people say moderation is me going home every day and having one glass of wine.
It's 2 to 3 units per week.
Yeah.
So in other words, a couple of glasses of wine a week, a couple of beers a week, that's fine.
Yeah.
Or 1 or 2 drinks a week. I mean, kept down to a moderation level, it's fine. And this is a message I like to give around the Christmas period. Guys, for heaven's sake, if you're going for a party, don't drive.
Yeah.
I don't want more work.
Yeah.
I get so much work because of people driving into walls, people driving into the bush and getting discovered 2 days later.
Listen, this is the one person that we want them to be lazy in their jobs. We don't require him to work like a madman. We are okay with Dr. Ernest being lazy at his job, because that means less surgery.
I'm sorry, I'm going to take over the talk talk about accidents.
Yeah, please.
3,000 accidents a year in an island which is 22 miles by 9 miles. Come on.
Wow.
3,000 reported to the police.
That is
What about the
insane.
ones that are not reported?
Yeah.
And most of the serious accidents always happen in the hours of between 12 o'clock and 4 o'clock in the morning, when they finish the entire binge. Then they get into a car and drive.
Yeah.
If you've had a drink, take the keys away from the person.
That's what a good friend would do. To be honest with you, that's what a really good friend would do. I've watched people leave parties and get an attempt to get into their car. If they're around me, I'm gonna call it out at all times, because I do that. I'm naturally like that. I'm be like, come on, it's not even about you.
Yes. And the whole problem is, one accident often has a second victim, one who is minding their own business, walking on the side of the road, and this maniac, I would say maniac,
Yeah.
I'm going to say maniac,
Yeah.
comes and plows them down. And we have 2 victims, and it's often the person on the cycle or on their feet who come off worse than the person in the car.
Yeah. It's important. I know this is a shift in conversation, but it's real. It is real. The reason that it is a shift in the conversation, because Dr. Ernest happens to be the head of surgery at HSA, so he sees this often. 3,000 is a high number.
Yeah, I know. I've just come from emergency. Yeah, there are a couple of people who are in accidents.
Yeah.
And it shouldn't happen in a place which is 22 miles. Well, how fast can you go on this road?
Yeah, it makes no sense. My worst fear is not any type of criminal activities happen here. Is, will I be safe going home?
Yes.
That's always what I ask. And even if I have to go somewhere, like, my wife is very funny about me going on the road at a certain time, because just like what you said, the accidents tend to happen between these hours, 12 and 4. But I dare to even say sometimes a little bit earlier, like 10 and onwards. And so when she sees that 10 o'clock time hits and I say, hey, I got to finish something at the radio station I completely forgot about, and I don't want to go do it in the morning, she's like, I'd rather you do it in the morning, because it's way risky, especially coming from our district north side, driving all the way down. Yeah.
Oh, yeah.
Where we tend the speed is a
You
little
go-
bit different up
Go
there.
on the Queens Highway at night.
Yeah. It's a little bit different. Somebody told him it's a racetrack over there, but
It is.
or
You
it's
see the
Formula
tire marks
One.
on the ground.
Yeah, all the time. I'm glad that more police presence are quickly coming up there, but yeah, we could talk about this all day, Doctor. This is one of those conversations. I agree with you. It's painful to have, and it's ridiculous that what some people are doing, but it's happening. But we got to make him get back to work, folks. We're gonna ask him one more question. Any other questions that you have, you can go ahead and send it through on our Instagram and Facebook page at Bobo 103.1. But what is your biggest message today, Doctor, for men, since we're in Movember, about just making sure to take their health seriously? Just what message would you have to them? A quick takeaway.
I think the message is take care of yourself. You need to know what you need to Recognize your body is saying something to you.
Yeah.
When you feel something, go forward. What is that L'Oreal ad? Because you're worth it.
Yeah, exactly. Exactly. You are. You are indeed. You
and
are.
if you don't take care of yourself, you don't expect somebody else to always look. I mean, that's being a child.
Yeah.
Yeah.
Yeah. Greatest advice I got before I got into radio was it was a painful thing to hear, because when I first got into radio, I kind of felt like, all right, good. I've made it through the tough part. I've done overnight radio, which is very hard. And a lot of people have not experienced that before, but 1 till 5 a.m. and it's every day. And then you finally get your own radio show and you think that these bunch of producers are going to come running behind you and they're going to put up all your advertisements and they're going to make you big. But then you're told the reality that nobody's going to care about you as much as you care about you, your dreams, your ambition.
Absolutely.
Nobody's going to do the MCATs for you when you want to become a doctor. You got to study for it. You're got to make it happen, right? So doctor, wise words, because you're worth it. And that's why you need to take care of yourself. You want to see your kids grow up. You want to see grandkids or watch your daughter get married, right? Or be around your wife, regardless how painful that can be sometimes, or when she's nagging you. But you want to be around your wife, right?
Yeah.
And live a fruitful life. Doctor, any advice? I find that there's a lot of medical students listening to the show. Any advice for any future surgeon?
Go for it.
Make it happen.
It's a difficult life. It is a difficult life.
I've heard.
But, and you have to stick the course.
Yeah.
And it's worth it. I mean, when you help somebody and you see how it's affected their life, it gives you that warm feeling. And I haven't stopped feeling that warm feeling. I've been a surgeon since 1992.
Wow.
Oh, God.
It's been a while, yeah.
Quite a while. But I've been a doctor for longer than that. But
Yeah.
I tell you, that's what keeps me going.
Yeah. Just
And
the
I'm going to
people.
go. They also say one thing: when surgeons retire, they die.
Yeah.
So I'm not going to retire.
You're going to keep going.
Yeah.
Nobody's operating on you. Dr. Ernest, it has truly been a pleasure. And you just made it a whole lot easier for, I think, a lot of men out there to get screening if they have to deal with doctors like you. Just makes it a whole lot easier to deal with conversations and making sure that screening is done. So book your screening right now. Call them at HSA at 949-8600. Once again, that's 949-8600. If you have any questions for Dr. Ernest, he'll be happy to answer any questions, whether they come choose the marketing team, or we can send it directly to him. You can just send it through us. We'll make sure it's screened first. Just make sure it's an appropriate question, and we'll get it over to them at of course, our Instagram is Bobo103.1 FM. But if you want to call him up yourself and book an appointment, 949-8600. Dr. Ernest, thank you so much.
Thank you.